expanding pharmacist roles, and improving the value of our impact. And we do have a great lineup of fantastic speakers for you today who will share their knowledge, insights, and expertise on those topics. Albina, Infono, have we started? I'm assuming we have.
Yes, we have. Move on. If you could please go to the next slide. Thank you.
Are you able to hear me?
Yes, we hear you, Sherif.
Okay, perfect. Okay, great. Thank you. So if you can please move to the next slide. If you can just bear with us a couple of minutes. It looks like we may be having some technical difficulties. Perfect. Yeah, please, the next one, please. Can you move to the next slide, please? Please bear with us. Okay, perfect. So we'll continue, and I guess with all digital events, sometimes we get into some of those technical challenges. I'm Sherif Guorgui. I'm a pharmacist from Canada and the president of FIP Community Pharmacy Section. And it is my pleasure to be your moderator for the webinar today. And also with me today from FIP are Infono Timothy and Albina Labib. So they are the ones who are making sure that all of those technical difficulties that we run into are addressed. So thank you so much for all your help with that in the background to ensure that everything goes smoothly for the rest of the webinar and that everybody here enjoys the learning experience today. Before we start, we just have a few housekeeping points. So please note that this event is being live streamed on FIP YouTube channel and is also being recorded. And if you do like the webinar so much that you want to watch it again, or if you want to recommend it to a colleague to watch, the recording will be available afterwards on our website at events.fip.org and of course on YouTube as well. If you're joining us live, we welcome your engagement. So please feel free to send us any questions that you may have through the question box. We will first go through all of the presentations and then we will open the floor for a discussion with our panelists, and we'll make sure to get to all of your questions at that time. Your feedback is very important to us. So if you wish to provide any comments on this event in particular or on our digital events in general, please send your comments to our email at webinars@fip.org. It's very important for us not only to know what we're doing right, but also to know what we can improve on. So please do send us your comments. And lastly, if you're not a current member of FIP, I would like to take this opportunity to invite you to become a member and to join our global network of colleagues from all over the world to advance pharmacy worldwide. So to learn more about the membership benefits and to become a member, please check our website at fip.org. We do have a new feature on Zoom. It's a translation feature. So if you would prefer to follow along with the translated captions, you can do that with this new feature. You can just follow the steps on the slide. They're very straightforward. Click on the closed caption icon, enable the translation toggle, and then choose your language. So in the webinar today, we will learn about the intervention opportunities for vaccine hesitancy. We will talk about the challenges for implementing pharmacy-based vaccination and how to overcome them. And then we will talk about the economic evidence and value of the vaccination programs in pharmacy. And after that, we'll have the panel discussion and answer any questions that you may have. So as you can see, it's a full agenda of for us today, and the main learning objectives are to recognize the effectiveness opportunities to address vaccine hesitancy, to understand practical strategies to expand pharmacy-based vaccination programs, and to understand the economic evidence of how pharmacy-based vaccination helps maintain the sustainability of the healthcare system. We have a panel of really amazing speakers today. Amy Chan from New Zealand, Matthias Arnold from Germany, and Emma Polino from Portugal. I will be introducing each one of them more properly before their presentations, but I just wanted to take this opportunity now to thank them for their time and for sharing their insights and expertise with us today. And before we start with our presentation, we do have a short video from our FIP president, Mr. Paul St. Clair. So if we can please go ahead and play the video.
Colleagues and friends around the world, hello and welcome to this digital event marking World Immunisation Week, a time to reflect on the incredible power of vaccines and the critical role pharmacists continue to play in protecting global health. This year, the theme Immunisation for All is Humanly highlights not only the promise of pharmacy-based vaccination, but also our responsibility as trusted healthcare professionals within our community.
Imfon and Anna, it looks like there is a bit of a problem in playing the video. It looks like the video is...
Sherif, I will continue with sharing the slides. Sorry for the apologies for the technical issues, everybody.
No problem. Thank you. These things do happen. It's okay. Thank you for your patience, everyone.
Colleagues and friends around the world, hello and welcome to this digital event marking World Immunisation Week, a time to reflect on the incredible power of vaccines.
Maybe if you can make the volume a bit louder.
Continue to play in protecting global health. This year, the theme Immunisation for All is Humanly Possible highlights not only the promise of pharmacy-based vaccination, but also our responsibility as trusted healthcare professionals within our communities. FIP's Think Pharmacy, Think Vaccination campaign, an auxiliary to the Think Health, Think Pharmacy global campaign, raises awareness of pharmacies as places of primary healthcare provision. In this context, vaccine promotion and delivery. We are convinced that it is through the pharmacy profession that much progress towards Sustainable Development Goal 3, good health and well-being for all, will be made. Investing in pharmacy-led vaccination is both sustainable and essential to achieving equitable access for everyone, everywhere. This week we have launched the resources on the policy progress, stakeholder engagement and the economic and societal impact of pharmacy-based vaccination. As we mark the last day of World Immunisation Week, today's event serves as a rallying call to further strengthen the role of pharmacy at the centre of immunisation efforts, now and in the years to come. We appreciate everyone involved in our continued effort to encourage the integration of pharmacy-based vaccination into healthcare. Thank you to our member organisations for their invaluable contributions and to all of you watching today. Together we can continue to make vaccination a global success story with pharmacy at its core. Forward with pharmacy, forward with FIP.
Thank you so much, Albert. And thank you, Paul. It's a great message from our president. And if anyone is concerned about technology replacing pharmacy professionals, I think we do have a very long way to go, but that's a topic for another webinar. The message from Paul was really a perfect way to start the event today, which is held on the last day of World Immunization Week, which is observed during the last week of April. As pharmacy professionals, we have a great role to play in raising awareness and in improving access for vaccination across all ages. In fact, from the global data that FIP collects, we now have pharmacy-based vaccination in 56 countries and territories around the world. And I always say that we should keep telling our story of how we stepped up during the COVID-19 pandemic. We should keep leveraging the momentum that we gained with both the public and governments during that time. And we should continue to leverage our value proposition of being accessible, trusted, and skilled. We're trusted because we are consistently ranked among the most trusted professions. We're skilled because we have the proper education, knowledge, and skills to administer vaccines safely and effectively. And we're accessible because in most countries around the world, most of the population lives within walking distance from a community pharmacy. So that being said, we offer convenient locations for immunizations, particularly in rural areas where healthcare services are limited. And by doing that, we help governments achieve their target vaccination rates to prevent disease. And that, at the end of the day, reduces overall healthcare cost and burden. So with that, it is my pleasure to introduce our first speaker, Dr. Amy Chan. Dr. Chan is Associate Professor and Respiratory Lead of the Medicines Intelligence Group at the School of Pharmacy in the University of Auckland. She holds an honorary post with University College London in the UK. She is a clinical pharmacist with over 15 years experience working in the hospital setting where she led one of the clinical pharmacy teams. She is also a minister-appointed councillor for the Pharmacy Council in New Zealand and member of the Respiratory Effectiveness Group, Open Digital Health, PSA Respiratory Task Force, and Board of Asthma in New Zealand. Welcome, Amy. Thank you so much for being with us today, and I will now turn it over to you.
Thank you so much, Sherif, for that beautiful introduction. And good evening, good morning to everyone, all our attendees from around the world. Thank you so much for joining this very important event as we come to the end of the World Immunisation Week. So today I've really been asked to focus on opportunistic interventions for vaccine hesitancy and the role of pharmacists. These are some of my disclosures, which Sherif has already covered. But straight on to the topic, I think we all agree especially if you have chosen to attend today's webinar, that vaccination is one of the most important things we can do to protect ourselves, our family, and our loved ones against ill health. And our data shows that vaccines globally prevent up to 3 million deaths every year. So without vaccination, without effective vaccination, it is very important to be able to see what the consequences are if we don't address vaccine hesitancy and promote vaccine uptake. So one of the things with vaccination is that although it is a very effective intervention, we are faced with this top 10 public health threat that WHO describes, which is vaccine hesitancy. So even though vaccines are available and can be very effective if used in our public and in our patients, many patients continue to be quite hesitant and unsure about some or all of the vaccines that they see. And this is one of the reasons where we think that pharmacists can actually play a really important role in addressing vaccine hesitancy. The difficulty with vaccine hesitancy is that it's influenced by multiple factors. And as you can see from this diagram, the reasons why someone is hesitant, it could be the patient in front of us, it could be ourselves, is that we see that the thoughts and feelings we have, the attitudes we have, the social norms and peer influences, our own personal experiences can all influence the decision to take up a vaccine or not. And these very reasons are very difficult to address and capture because it varies across time, both within an individual and between individuals. The good news here is that vaccine acceptance or vaccine hesitancy is not static over time. And what this diagram here shows is that over time, the decision to vaccinate and the thoughts and feelings really do shift across a spectrum. So you'll see in most of the patients that we see in the majority of this spectrum is they are either acceptors or they are hesitant, in which they may have some concerns, but ultimately those people who are either fully accepting or cautiously accepting with minor concerns, or they're in the movable middle, in the hesitant in the middle of the diagram, but they will eventually still vaccinate fully with support and education from the health professional. There's still also particular patients in the late or selective category where they're wanting more information. They are cherry picking or selecting certain vaccines, but they may vaccinate partially. And then there are the decliners, those who are definitely vaccine hesitant. They may have never vaccinated or no longer vaccinate. But actually what this shows you across the spectrum is that most of our efforts should really be targeting the cautious acceptors, the hesitant, and maybe the late and selective people, and that would capture the majority of the patients that we see. So why are pharmacists so important? Well, actually, what a recent review that was done by this excellent team published just last year in JOP showed that pharmacist interventions have a very significant effect on supporting immunization. And what you can't see because it's actually off the graph, but actually those pharmacists who were involved in supporting vaccination, patients were 1.5 times more likely to take up and were accepting of vaccination compared to groups which did not receive pharmacist input. And actually what we found is that regardless of the type of intervention compared to usual care, having involvement of a pharmacist actually improves the overall immunization uptake by up to 51%. And while immunization frequency doubles, in particular, if pharmacists also act specifically, not only as vaccinators, but advocators to address vaccine hesitancy, which I think makes the case for today on why pharmacists should always be thinking about promoting vaccine uptake and addressing vaccine hesitancy. So this is from the WHO guidelines around the need to engage communities. So we know the need is really in our communities, and pharmacists are very well placed to address the needs of our community. But I've been asked to talk specifically on the last part. Not only do we need to understand the community needs and try and deliver vaccination in our workplace, we must seize every opportunity as much as possible to vaccinate. And this is the opportunity that I'm going to focus on for the rest of the session. When it comes to addressing vaccine hesitancy and opportunity, is really we want to start with collaboration with our communities. And this was an excellent example in the NHS where they were collaborating with the community. They parked outside to try and address the vaccine hesitancy in the Muslim community. They actually went out to the mosques and the gatherings where these communities met during the weekends, and these pop-up services actually supported vaccination by going to the communities and allowing it to be much easier to access the vaccines that they needed. And you can see from the data that actually patients access community pharmacies 12 times more frequently than a GP. And in particular, the reach of community pharmacies are able to reach our rural populations and our deprived communities much more than the affluent ones, which is also why it's very important when it comes to addressing equity gaps. And within New Zealand as well, we also had several pharmacy initiatives that we have had to address vaccine hesitancy. So similar to the case study that I just shared, we have also had Marae-based visits to try and work with our Indigenous community and reach vaccinations by going to the places of gathering. But also pharmacies also deliver off-site vaccinations. And much more recently, pharmacists have been allowed to vaccinate all of life, starting from childhood vaccination. And this change that started from April the 1st last year has really allowed pharmacists to provide vaccines both to mothers and children and really offer that opportunity to address vaccine hesitancy at every point in time. So this comes from the UK NICE guidelines. And what this really shows here in the first part is it's really important to think about identifying eligible people, the opportunity to vaccinate, and where possible, either refer or discuss and offer vaccination. So in terms of behavioral interventions, looking in terms of addressing uptake, you can see the most effective intervention that we can all do to really promote vaccine uptake and address vaccine hesitancy is provider recommendation. And this is where the pharmacist recommendation can play a really important role to address uptake. So when it comes to making the most of opportunity, this is what I really recommend based on the literature and the personal experiences and working with communities. The first thing is really to normalize and initiate the conversations about vaccination. But there is also this diagram: prepare, listen, understand, and engage. And I'm going to be using this framework to think about how we can engage those opportunities. The first thing is around preparing. So you never know when a patient will walk into our pharmacy. They may be asking for something else. They may be asking for cold and flu medication. They may be seeking health advice. But actually, every interaction is an opportunity for us to intervene and suggest whether they want to vaccinate or address concerns. So one of the things that came up as an example may be around highlighting any concerns a patient has. So you may address concerns and identify and normalize that it's completely understandable for the patient to have concerns. And you can also say personally that there have been questions that you've received from others and invite the patient to share their concerns. So one of the answers may be from the parents saying that, they're very concerned about the offer of the HPV vaccine for their patients, particularly for their own children or their own daughter, because they're very, very young and they're a long way from being exposed to risky behaviors. And then you can address those concerns and highlight that actually we understand they are concerned, but also offer the opportunity and ask for permission to say, can I provide you some information about the vaccination? And rather than just offering information, it's that process of seeking consent, engaging with the parent, but also highlighting, is it okay that I share what I think about the vaccine and what I've come to think about in my learning? So here is one way you could frame, so in the preparing and listening part. I think you can say that one of the things you can think about is that, you could highlight what you used to think about to address a common misconception. To say, I used to think of this vaccine as something to prevent a sexually transmitted disease, but I realize now it's about preventing cancer. Almost everyone gets this virus, so I think it's important for everyone. And then you also can say and highlight, what other people in the community are doing. You could say almost all of my patients are now getting this vaccine, but then also address the importance of the patient, and ultimately it is their choice, that it is up to them and their decision whether or not to take the vaccine. In terms of this listening and understanding process, what this diagram shows you is how you may actually influence their behavior really comes to whether they are uncertain or they're unlikely or likely to take part in vaccination. So if you think the patient in front of you is really interested, then you really just want to make it as easy as possible for them to take the vaccine. You could offer the vaccine right away or point them to where they can book an appointment. Most patients you'll see will be in this movable middle, in the yellow part, where they may have some questions. And so our role is really to, in that opportunity, to influence and motivate the patient. For patients here, which are much less likely to vaccinate, is really around building trust. So you may not be able to offer the information straight away, but you want to think about, are there trust barriers you want to address? Can you build a relationship with the patient? And can you somehow remove any physical barriers to make it as easy as possible for them to reach you to have those conversations? And this diagram also reflects what I've just said to reinforce. It really comes down to a phased approach when it comes to communication about vaccination. If the vaccine is easy and accessible, you want to make it easy in your pharmacy and accessible, create reminders and posters so people are aware about it. But for patients who are more hesitant, you do need to have that one-on-one time to allow that trust to build and address also their perceptions and share stories as much as possible, as well as partnering with the community. So in summary, really just thinking about the opportunity you want to understand and engage. First of all, you may want to start with low-cost, broad impact interventions, such as posters in your pharmacy, and offering available walk-in vaccination to nudge behavior change. But if it's not working, you may think about where it's working and why it's not working. And that's when you may think about more intensive interventions that address someone's motivation. The strategy that you want to think about really comes to what the underlying reasons are in front of the patient. So when you have the opportunity in your pharmacy, you want to be able to assess and understand, is it a reason because they can't access the vaccine? They may be motivated, but for example, they don't know how to get the vaccine, or they don't know enough about the vaccine, in which case you could use more automated strategies such as reminders or booking in an appointment or online booking to support vaccination. But on the right side of the diagram, if it's not a question of ability, but it's really they are have concerns about the vaccine, or they're not motivated, or they don't understand the need for the vaccine, that's when you want to think about behavioral tailoring and using personalized strategies to try and increase confidence and reduce complacency. So really, when it comes to the process and in terms of supporting motivation, is really a battle of hearts and minds. I really like this diagram because it summarizes some things that you can think about to try and keep your patients engaged, working on building the relationships and drawing on your own stories, and trying to connect vaccines as much as possible to your current vaccination and your visit. Often I find that if you can make vaccines and relevant to what they are most concerned about, for example, if they present to you with cold and flu symptoms, you could suggest and bring up vaccination as an effective prevention strategy to prevent further cold symptoms, to make them feel better, or so they don't actually have a flu in the first place. But in all times, you want to be kind as well as firm when recommending the vaccination. And then when it comes to addressing misinformation, we also want to think about ways to address what they have said and what they have heard from their communities. And the best way when it comes to looking at information they may have heard, these are some strategies that the evidence have shown. Being able to communicate the evidence, being able to identify and use humor to dispel myths, but actually potentially unhelpful as scare tactics and not acknowledging uncertainty. So as much as possible, if you have a concerned patient, we do want to acknowledge that it's okay to have concerns and offer scientific evidence to dispel any myths. In terms of engaging, last but not least, The main 5 communication principles that we suggest is to much as possible capture the attention of the patient in front of you when it comes to vaccination. Patients often think if it's easy to understand, it must be true. So try and communicate information as easily as possible, and that will really increase the uptake. You want to use credible, factual facts from science to motivate them, and community stories. If you can share stories of success from other people or from your own colleagues, that will really support effective communication. So ultimately, it's this 4-step approach when you want to make the most of opportunities. You want to be able to be prepared for when a patient walks into your pharmacy. You want to listen to any concerns that they have and understand, and then consider using those communication principles to really engage and feedback to the patient. So if you have more questions, and there's really effective FIP vaccine resources that you can go to learn more around making most opportunity. But at the end of the day, really welcome all of you to have some questions as part of the Q&A. You can get in touch with me on LinkedIn or on X or sending me an email. But I look forward to the discussions around hearing how you make the most of the opportunities in your pharmacy today. Thank you.
Well, thank you so much, Amy, for this very informative presentation. A very important takeaway for us here is your point that we must seize every opportunity. Now, I'm being told that due to the time difference in New Zealand, you are only able to attend some part of the webinar. Are you able to stay with us a bit longer?
I did say I will try and stay to the end, so
okay,
I will.
Perfect. Well, thank you. So in that case, we will hold off on any questions from our colleagues until then. Thank you so much again. And now I would like to introduce our next speaker, Mr. Matthias Arnold. Mr. Arnold is the Vice President of the Federal Union of German Associations of Pharmacists and has been the head of ABDA delegation to the Pharmaceutical Group of the European Union and FIP since 2018. He is also a board member of ABDA, the first chairman of the Association of Pharmacists of Saxony-Anhalt, and owns a branch network of pharmacies. With close to 4 decades of professional practice, he regularly lectures in pharmaceutical education and training on travel and tropical medicines, viral diseases, psychotropic drugs, and vaccinations. Matthias, welcome, and thank you for being with us today.
Oh, thank you very much for the friendly introduction, and hello from Germany, and good morning or good afternoon or good evening to all the participants here in the world and wherever you are sitting and listening to me. Yeah, let's try. Vaccination, we speak about the tackling hesitancy, the expanding pharmacist's role and the providing impact, and let's see some words to this way. First of all, I think we don't have to discuss, we fully agree, is vaccination is a value itself. Of course, it's an individual benefit, prevention of illness and suffering, of course, but on the second hand, there is a benefit for the society as a whole, lower disease burden and lower burden on the social security systems, and of course a little bit economical effect. It's a fewer absence from work, and we have to see both of these things if we're discussing the vaccination problems with the politics, with our insurances and so on. And therefore I think we have a view from a little bit higher way to discuss all these problems. And so we have at first see the challenges we have. Of course, thank you, Amy, for this really very, very well report. And we have to fight against vaccination hesitancy, of course. And we have to discuss all these informations based on facts and on scientific data, and we have to fight against fake news on this area. And of course, we have to create a positive social environment, maybe through campaigns, maybe through social networking, maybe through personal information and so on. you show us all these ways. And I believe one of the most important thing is trust. I believe trust is a currency in healthcare. And pharmacies, we have seen it over and over times, and we see it each year again in some polls. Pharmacies have a high level of trust. The patients trust in our pharmacies, and this is a good beginning for communicate with our patients on the patient's level, of course. In a pharmacy, we meet all different people. We meet people which are professor or which are scientific, or we meet normal people and we meet people, they have no flat, for example. And you have to look for the level of the patient in order to communicate with them. And we have to transfer some positive experiences from the patients to the vaccines. We see a lot of people, they take daily drugs, for example, and they see the effort, the effect of the positive effect of these drugs. And we have to discuss why don't use the positive effect of vaccines. They are from the same producers, they are from the same scientific institutes, and so on and so on. And I think this could be one way to solve all these social challenges. Allow me, please, to show you a little bit the situation in Germany. In Germany, we have a wide range of vaccinations, and the citizens don't have to pay for these. And the reimbursement of the statutory health insurances found this regulated, and it works. There's no problem for reimbursement of these vaccinations done by a doctor or done by a pharmacist. And on the other hand side, we have a growing problem with vaccination opponents and with vaccination hesitancy. Yes, we have it. And it's a little bit a mixture from all these points we discussed already. And we see it's take place in the political discussion too. Vaccination in Germany are normally given by the doctors and partly by the pharmacies. The pharmacies at the moment only for flu and COVID. The training of the vaccination pharmacists is uniformly regulated by a curriculum, and this curriculum is coordinated with a medical profession organization. Therefore, it's the same curriculum for all, and it's in content, and the content and the working is done a little bit by the doctors. We have, at the moment, we have a change in our government. We are hoping we get next week a new government. But these potential government parties, these are building this government, have a positive view on the vaccination by pharmacies. We heard it often and often. And so we believe that our next step would be to vaccinate with all inactivated vaccines, not only flu and COVID, all inactivated vaccines in the first step, only for adults, I think so. Where are the problems, or where are the values? Where's the value for the pharmacy, not only for the people, for the pharmacy? We're asking in a small poll the owners of a pharmacy, and of course, the most of them said the most value for the people and for the pharmacy is the easy access to vaccination. The patients told us often and often and over the time, yes, it's very easy to access a pharmacy, and the pharmacy is active in contribution to prevention. It's a good signal for the political and for the discussion about reimbursement, for example. Pharmacists' profile was sharpened through vaccination. We are not only people that are selling drugs, we are a healthcare worker, and this profile is sharpened through vaccination in the pharmacy. And consumer expectations are met, of course, 35%. Additional income, it's not the majority, but it's 26%. And of course, 16% don't know. Okay, this is normally in a pool. But we see on the other hand side some problems shown by the owners. The first problem, and you see it's 71% said it's a problem for me with the additional personal costs in the pharmacy. It needs workforce and it needs work time. Additional requirements in the pharmacy. I need a special room, need a special equipment for example. And they are afraid, are concerned about the relationship with the neighboring doctors. They could say, if you begin to vaccinate, we are no longer friends and we have some problem together. And I would tell my patients, don't go to this pharmacy and so on and so on. And some owners said, yes, we have a problem because vaccination is a medical task, not a pharmacist's task. In this 28%, we have to discuss, we have to explain the change in the time, we have to explain what happens around the world in order to reduce this number of people. On the next, you see here the value for the patient. We ask it to, and the patient said, and we find which groups of patients we found in our pharmacies in order to get the vaccination. 20% get their first flu ever in a pharmacy. They never had before a vaccination against flu. 13% would not have a vaccination without an offer in the pharmacy. They don't have a GP, they don't have a real contact to a doctor, and they use the contact to a pharmacy in order to get a vaccination. Over 19% said, I'm willing to get another flu vaccination at the pharmacy, and the same number said, readiness is other vaccination in the pharmacy. If you do it, I will come to you in order to get this. And what are the reasons? What speaks in the pharmacy service? At first point is the trust and the professional competence are the key to the patient's care. It's the main point, and I so often said it, and I repeat myself so often. Trust and the professional competence is our key to the patient. Vaccination building a special kind of competence. Vaccination advice at first. Second, recording of vaccination status. These were processes we offered in our pharmacies before we began to vaccinate in the timeline. And therefore, as the government discussed the questions, should pharmacies vaccinate? We said, sure, we have the trust, we have the competence, we advise the patients about the vaccination, recording the vaccination status. Why should we don't vaccinate? And after the vaccination, of course, we make a documentation for the insurances, for the patients, and we show it's the same process like a doctor is done. And so we are healthcare workers, the same as a doctor. And I think it's very important to be in keeping in touch with patients, follow up. What is your feelings after the vaccination? When will we do the next one? You looked at your status. I would remember you in 1 year, for example, there is a new vaccination is necessary, or you have the possibility to get one. Vaccination is yes. Is a pharmacy service, and I learned in the daily work we should use specific moments to broach. So, for example, you say, oh, there's a minor endurance. The patient said, oh, look, I had a small accident, for example, also. And you can ask, what about your tetanus protection? Is it still up to date? You find a patient and it's birthday. For example, he gets 60 years old, and you can say, now we can offer you special vaccination for elderly people. For example, herpes zoster or pneumococcus, or children reaching puberty. HPV is a theme. You show us a fine example in your report, Amy. And in my case, there's often the discussion about the travel planning. And the people said, yes, I'm planning travel, I'm planning holidays, spend time in Africa or spend time in South America and so on and so on. What should I do in preparing for this travel? And I said, let's look to your vaccination status and let's talk about travel vaccinations, for example. These are small points in the daily work we can use in order to find the contact to our patients, to show our competence and use our trust. We have, on the second trend, we have vaccination times at the end of the working day. They are very welcome by our patients. And we hardly anyway waiting times. The patients looking for more possibilities in order to get it. Very patient-friendly appointments, of course. This is our offer. And we learned in a modern time, we have a lot of influence, a lot of informations to patients. And we see one moment in this public relationships, one in the advertising, is to create events. For example, in German, Lange Nacht des Impfens, directly translated, could say long night of vaccination. It means you make an event, you say this night is a night of vaccination. The night is not really the long night, it's only 10 or 11 o'clock, but it is an event, and the people say, oh, there is an event, let's use this change. And you can make some campaign days, for example, a week of vaccination, for example, in connecting with some township or town or days or so on. And we have a lot of health days as an organization in order to get the contact to the people. And at my personal working and from a lot of information, our organization, I can tell you, these events were very effective in order to get a lot of people bringing to the vaccination. We have, of course, a lot of challenges of the pharmacies, and we have to discuss these challenges too. We need practical and legislative solutions for these pressing issues. One of the greatest problems in our country is the question of workforce and working hours. We don't not have enough workforce in our pharmacies, and by demographic reasons, this is a problem. We have high requirements for the space, a special room, some possibilities, and so on, and technical and hygiene equipment. This have to be solved, the problem, and we have to ask ourselves, what do we really need and what is really necessary? We had a lot of bureaucracy and administration. We should reduce this because a lot of these things don't have any effect on the result of a vaccination. We need the definition of necessary qualifications of the staff. We have appropriate further developments of the university training content, of course. At the moment, it isn't realized. And we have to discuss the remuneration of the service provided by the pharmacies, because without remuneration, it will not fly, really. And at one remark at the end, I discuss it very often with my colleagues. Additional services, pharmaceutical services, vaccination, prevention services, and so on, are very important and essential for the future of the pharmacy, but they can't replace the core competences. We don't forget never our core competences. And therefore we need all these solutions I discussed already. Please keep in mind, and therefore I think we should say thank you very much for this audience, and I'm looking forward to your questions. Thank you very much.
Thank you so much, Matthias, for this very insightful presentation. It was interesting to hear that one of the arguments that some pharmacists have against vaccination was that vaccination is a medical task and not a pharmacist task. Because I can tell you that there are other jurisdictions, like in Canada, for example, where vaccination is actually seen as a technical task. And we have regulated pharmacy technicians that do administer the injection. The pharmacist still needs to be involved, though, on the clinical front before the vaccine is administered to ensure it's safe for the patient to take. But it's just very interesting to see the different perspective around the world. So I'm sure there'll be a lot of questions from colleagues later on, but we'll now continue with our next speaker, Ms. Emma Polino. Emma is a practicing pharmacist at her own community pharmacy in Portugal. She is a scientific and professional coordinator at ESFI, which is a company that engages community pharmacies in the implementation of patient support programs. Emma is president of the Portuguese National Association of Pharmacies and was a member of the National Board of the Portuguese Pharmaceutical Society. Emma held various positions at FIP as professional secretary, member of the executive committee and bureau. She is past chairperson and project coordinator of the Young Pharmacist Group, a member of the FIP program committee, and secretary of the community pharmacy section. Emma was a member of the board of the Pharmaceutical Care Network Europe and is currently a member of the board of the International Primary Care Respiratory Group. Welcome, Emma, and thank you for being with us today.
Thank you. It's really a pleasure to be here with you today, and thank you for the kind introduction, Sherif. And I would like also to thank the previous speakers for their inspiring presentations. So I will be talking about the economic part of the service, and this is important when we are advocating for community pharmacy involvement in this process, but it's also important at an internal level that we understand the economic importance of what we are doing and that we value that intervention accordingly. So I will be talking about this economic evidence for pharmacy-based vaccination. So why are we talking about this? I was just introducing that earlier. So vaccination, we believe and we know for a fact, based on evidence, that it is a cost-effective public health intervention, one of the most effective cost-effective interventions that we have. Pharmacies are accessible and mostly underused as vaccination sites. So there's an untapped potential for increasing coverage. And we also know that economic data can guide better policy decisions. So we should gather economic evidence of this involvement. In Portugal, we have been vaccinating since 2007 and in community pharmacies, and community pharmacists are able to acquire that competence, or we can hire nurses to provide vaccinations to the population. Mostly in Portugal, vaccines administered in community pharmacies are administered by community pharmacists. We have been working on this service for quite a number of years. And in 2023, a team from the National Pharmacy Association actually led a literature review to review and to summarize the economic evidence for pharmacist-led vaccination services. And this is the publication that you see here on this slide. So it was a non-systematic literature review. These are the databases that were used to search for relevant literature, and the PICOS process was used. In terms of the characterization of the studies that were to be included in this literature review. So population, community pharmacy customers, the intervention was the provision of immunization services at community pharmacies. We assessed any comparator, and we were looking at results from economic evaluation studies or from any study that included the measurement of costs and or service use. The study design was basically the team looked at primary studies that addressed any economic outcomes, quantitative or qualitatively. So based on this search that was done using these databases, the results, I'm sorry, going back one slide. The team managed to retrieve 707 records that were identified through this database searching. And then based on a more critical review of the results, the team ended up including in this literature review 11 studies. All studies were conducted in North America, so 9 in the US and 2 in Canada. So one of the conclusions that we may already draw from this review is that we need further research in other regions of the world if we want to have more economic data that is more adapted to regional characteristics. Also within these 11 studies, 7 studies focused on influenza vaccine, 4 on herpes zoster vaccine, 3 on pneumococcal, and 1 on other vaccines. Obviously, this doesn't add up to the 11 studies, so some studies involved more than one type of vaccine. And in terms of the methodology that was applied for the economic evaluation, we have full cost utility analysis in 1 study, cost offset analysis in 6 studies, so most of them, and cost studies in 4 studies. As results, what the team ended up concluding was that pharmacy-based immunizations are an effective method of increasing the vaccination coverage based on the studies that were retrieved for this review, by increasing vaccination rate and by decreasing healthcare resource utilization and costs. For some of the included studies, when productivity costs were also considered, the investment in the additional vaccinations was cost saving. This actually saved resources to healthcare systems. So as a conclusion of this review, pharmacist-led vaccination services in community pharmacies were found to offer economic benefits, including cost savings and increased vaccination coverage. These services effectively raise vaccination rates and reduce healthcare resource utilization and costs. Particularly, this was found for influenza, herpes zoster, and pneumococcal vaccines. As I've mentioned before, economic evaluations of these services are limited in size and scope, with most studies being cost offset analysis. Further research, and especially in Europe or other regions of the world, is needed to comprehensively understand the economic benefits of delivering vaccines at community pharmacies. So based on this review, in Portugal, we decided that evidence from Portugal was needed and that we could also contribute to this body of literature showing cost effectiveness of these services as provided by community pharmacies. So we took advantage of the fact that community pharmacies in Portugal were widely integrated in the 2023-2024 seasonal vaccination campaign against influenza and COVID-19 to perform an evaluation of this campaign and particularly about the role that community pharmacies had in terms of different indicators that we identified to be measured. So just to provide you a little bit of background, as I've mentioned, we've been authorized to administer vaccines already since 2007. I believe we were the first European country with this authorization, and we participated in the first influenza vaccination campaign already in 2008. Then we had some legislative changes that meant that the flu vaccines were provided free of charge for all Portuguese citizens that were considered eligible, so mostly elderly patients and also those with certain comorbidities. And the government decided to provide these vaccines free of charge in healthcare centers. So we did decrease quite a lot the number of vaccines that were administered in community pharmacies to these populations because in community pharmacies people had to pay the co-payment for the vaccine, a small co-payment, but also the administration service. So some of the population actually preferred to go to healthcare centers to get the vaccine for free. But at the same time, we also had population that, irrespective of the fact that they did have access to the free vaccine in healthcare centers, they still chose to go to a pharmacy and pay for the service and pay for the vaccine because they considered it more convenient for them. During the pandemic, we were not involved in COVID-19 vaccine administration because the country decided that they would like to centralize all the vaccination campaign in big healthcare centers distributed throughout the territory. And it was quite an effective strategy. Portugal was the first country to achieve the coverage that the vaccination coverage that the World Health Organization recommended. But after the whole pandemic season, during those years, they decided that they would eventually close these big administration centers, and that the administration of vaccines would go back to the community. And when they decided to go back to the community, which was in 2023, they thought that it would be best to combat vaccine hesitancy and to make this process more convenient and more accessible to the eligible population, to provide both flu and COVID-19 vaccines for free, not only in healthcare centers, so from the National Healthcare Service in Portugal, but also through community pharmacies. So pharmacies have been involved in this administration of free flu and COVID-19 vaccinations since 2023. So this is our second year participating in the global campaign. So some numbers that we got, so big indicators of the success of these community pharmacists' involvement. So we have approximately 2,900 pharmacies in Portugal, and almost 2,500 pharmacies were involved in the service. So there was a huge uptake from community pharmacies in Portugal to be able to administer these vaccines. And over 7,000 community pharmacists were administering vaccines in this campaign. So eventually, pharmacies administered more than 3 million vaccines, the majority flu, but also a good number of COVID-19 vaccines. And pharmacies and community pharmacies actually ended up vaccinating 70% of the population. So 7 out of 10 vaccines were administered in community pharmacies, whereas only 3 out of 10 vaccines were administered in healthcare centers. The impact on NHS healthcare activity, and we also measured this because we thought that this would be important for the government to understand, is that we saved 310,000 working hours in primary healthcare centers, which allowed nurses to be available for other kind of activities besides vaccination. This is equivalent to around 685 nurses for 3 months full-time. We also calculated what this represented in terms of the nursing care capacity in primary healthcare centers, and this actually represented a 10% increase in the nursing care capacity by having community pharmacies also participating in the campaign. We also measured patient satisfaction, so participant satisfaction, and we had data on satisfaction with the vaccination campaign from 2022. So we did another satisfaction survey in 2023, 2024, and what we saw was an increase in satisfaction of the population by having this service available in community pharmacies. In addition, we also looked at how the vaccination units were distributed and what this represented in terms of transportation and people needing transportation to go to healthcare units to be vaccinated. And what we saw is that if we only considered NHS vaccination units, so healthcare centers, a lot of the population, particularly in more rural and interior inland areas in Portugal, would have to travel more than 7 kilometers to be able to access a vaccination center, whereas when we included the community pharmacies, we decreased that distance quite a lot. So there was actually a reduction in the average distance between the population and the nearest vaccination point of at least 50%. Then we also had an increase in the average number of vaccination locations per municipality due to the extension to pharmacies. And this meant that we had 4 times a higher number of vaccination points than if we had only had the NHS vaccination units. We also calculated the impact in terms of reducing the average distance in municipalities, and what we found is that we increased accessibility more in municipalities with a lower density of population, with more elderly population, and municipalities also with lower purchase power, so poorer populations. We also calculated the reduction in total CO2 emissions, which was calculated to be around more than 1,000 round-trip flights from Lisbon to Brussels. And we calculated the savings on travel for the Portuguese population, and we calculated it on around 2.4 million euro that were saved because people could go walking to the vaccination center, so to the community pharmacies, whereas before, or if they had to go to a healthcare, to a primary healthcare center, they would have to have paid for public transportation or even for gas for their own car. So when we look at vaccination coverage, which is the most important indicator for the country, because we estimate then that we have savings in terms of healthcare resource utilization, we see that we had a good vaccination coverage even after the pandemic, and we know that vaccination coverage in the majority of countries decreased quite a lot after the pandemic, but we maintained vaccination coverage rates very high. So for influenza, for people over 65 years of age, of 72%, and for COVID, 61%, which was actually 5 times higher than the average COVID-19 coverage rate in Europe overall. So what we saw was overall a reduction of barriers to vaccination access, an improvement in patient satisfaction, a reduction on national healthcare service resources burden, economic savings for individuals, I mentioned those, and a potential positive impact. We can only believe that we contributed to this population vaccination coverage. Barriers and limitations, obviously regulatory restrictions, reimbursement and payment models. Obviously, we had a contract with the NHS to provide these vaccinations, which was of in the first campaign, 2.5 euro per vaccine that was administered, and this year it was increased to 3 euro, but obviously it's a very low rate, but we decided that we wanted to start and to gather more evidence in order to now increase the value that we charge for these vaccines to be administered. And this was successful because, as I've mentioned, we have increased from 2.5 euro to 3 euro per vaccine. Also, we have vaccine hesitancy, which is something that was already talked about, and it is very prevalent now. And we also have the limited engagement and public awareness, particularly of the importance to continue to be vaccinated, to have booster vaccines for COVID-19, which people already see as something that was really far gone into the past. So before I thank you for listening, I would just like to say that we in Portugal, we are also, sorry about the slides, but we are also monitoring this vaccine hesitancy and trying to provide pharmacists with the right messages to be able to combat this vaccine hesitancy. And as we've seen from the first presentation from Amy, we do need a lot of education for community pharmacists to be able to address these concerns and this hesitancy in a way that doesn't seem patronizing, but welcomes people's concerns and deals with those concerns with an adequate narrative. Although we are obviously, as healthcare professionals, very concerned about the decrease, the potential decrease in coverage and what that means, particularly for the most frail population. So now I would like to thank you for listening and also for the kind invitation from FIP to be here at this webinar. I'm now fully available for any questions you may have.
Thank you so much, Emma, for this excellent presentation. As always, really. I'm sure you'll have a lot of questions for you, and we'll get to that very shortly. It's good to see those results on the pharmacy vaccination program in Portugal, proving that the expansion of the pharmacy scope to immunize not only supports public health, but also saves costs, which is really the magic formula that would get any government's attention, that better health outcomes and lower costs. Before we move into the questions from our colleagues, I just would like to welcome now Imfan Timothy to highlight some very important work, tools and resources that FIP has developed. Imfan is the Disease Prevention and Self-Care Program Coordinator at FIP. So Imfan, welcome, and the floor is now yours.
Thank you very much, Sherif, and a big thank you to all of our speakers for the great insights shared so far. So I'll just get right into this. I just want to quickly share the resources we have at FIP, which you can maximize. In addition to the resources from the previous year, this year we have already launched 3 additional resources on pharmacy representation, on the National Immunization Technical Advisory Boards in different countries, and then a knowledge and skill guide for vaccination, as well as policy progress, stakeholder engagement, and the challenges in pharmacy-led vaccination, which we have observed from our findings in previous years. So to access these resources and more, please just scan the QR code, or you can visit the site as posted in the chat. And then we have some FIP seal courses. You might have questions about what certification can I get, what courses are available for me to post my knowledge. So we have those courses at FIP. So the FIP seal we have for impetus to flu vaccination, uptake and coverage. We also have one around vaccination and injectable medicines administration. We also have another one on COVID-19 education for pharmacists and mpox vaccinology training program. We agree that these 2 have been our most recent outbreaks, which we have been very vital in keeping the community aware and being safe. And then we also have a seal program on parenteral administration medicines program. So please scan the QR code as you see here to access this FIP seal courses and have more knowledge than we have for this particular competency. Thank you so much. And back to you, Sherif.
Thank you so much, Infant, for this very nice overview of these important resources. Really great work by FIP on this, and these tools are available on the FIP website, as Infant had put the link to them in the chat. So certainly would encourage all of you to check them out. And thank you again to all our speakers for the great presentations. So we'll now open the floor for questions. I believe we have about 15 minutes, so I think we can get through a number of questions here. Just a reminder to please write your questions in the question box, and we'll make sure to get to them. I think we already have some. And I see that also Amy has been getting a head start answering a lot of questions privately there. So try to get to read some of those, but we'll maybe now get to some of the unanswered questions. The first question, in India, vaccination performed by nurses or doctors, what are the necessary things for regulators that the pharmacist can be done by pharmacists? I guess, yeah, we'll get the gist of the question. Maybe first, before I open this to our panel, I can probably just say something very quickly on that, because more especially from the community pharmacy section, we have partnered with the academic pharmacy section and the Education Foundation of FIP to do some work with the Indian Pharmaceutical Association for a project funded by the Board of Pharmaceutical Practice of FIP to get pharmacists trained in India as a vaccination pilot project to help the Indian Pharmaceutical Association with their advocacy efforts to try to get the scope of practice for pharmacists in India to vaccinate. We have conducted last December the second phase of that program, where we got the pharmacists who were trained in the previous phase to train other pharmacists, and there were about 40 pharmacists that participated in that last phase in December. So overall, right now, we have about 80 pharmacists that have been trained in India. And just as part of that vaccination project, then the hope is to continue to open to more regions, to train more pharmacists, and to help with the advocacy efforts by basically telling the regulators that pharmacists have the scope and the competency. And also, when we look at sharing a lot of the great success stories that we've heard about today, that can also help with those advocacy work as well. So hopefully we'll get the pharmacists vaccinating in India, hopefully very soon. So just wanted to just comment on that work there, but would open up to the panel if there's anybody who would like to add anything. It's good. Okay, so now we get to the following question. Earlier, it was mentioned that the relationship with neighboring doctors suffer as one of the arguments against vaccination for pharmacy owners. What can be done to address these barriers without necessarily compromising the doctor-pharmacist relationship? It's a very good question. I think, Matthias, this probably, this one is for you.
Yes, I said already, in Germany, normally the vaccinations are free for the patients and paid by the NHS system, and therefore the price of the vaccination or the price of the vaccine is normally no point of discussion with in the debate with vaccination, etc. There's no problem because there's no costs for the people. The problem in Germany, I think it's mostly it's growing up problem, and it is born a little by COVID, and at least I have the feeling the people have some problems with a more how to say paternally state. They are feeling the people will made to a subject, or they made it to an object and no longer a subject in the system. And they want to make their own decisions. And they have a feeling the government puts them in a role and say, you are my object and I bring you to the health you need. And the people have concerns about this. And this is a little bit more a political question than a healthy question, or a question of the health system. And I'm concerned some people do it as a protest against the government and don't realize it is effect for their own health. They are against vaccination because they find it is a way in order to make a protest against the government. It's stupid, of course, but I think this is sometimes the argument. But the price is not really an argument.
100%. And I think it's all about ensuring that the messaging is relayed to the stakeholders, whether it's in the government or also our colleagues as well on the other healthcare professionals, whether it's doctors or nurses, because I think our position collectively as pharmacists is that we do not want to replace doctors. So we have no intention of doing that. And it has never been a turf war with them. We understand and that maybe this is part of the messaging we should be sharing, that there will never be an empty seat at a doctor's office. We just want to make sure that we have the right patient in that seat. And these are typically patients with probably more complex conditions, and that's how we can expand the capacity of the healthcare system. So thank you for that, Matthias. We can then go to the other question. Pharmacy-based immunizations may improve access. However, I wonder about the competency of pharmacy professionals, especially in low middle income countries. How can we improve capacity of the pharmacists and safety of the public? Anybody would like to tackle that one? Emma?
Sure, I can talk about that. It's through training that we have mentioned, and the FIP has a lot of resources in terms of the training that should be provided to ensure that pharmacists are able not only to administer the vaccines, because that's a very simple procedure, but they have to be ready if any adverse reaction occurs, particularly anaphylactic reactions, which are very rare. I can tell you that we've been vaccinating since 2007 in Portugal. We have administered millions and millions of vaccines, and we've never had a situation where a patient had a very, very serious reaction in community pharmacies. All the issues that happened were conveniently handled by the community pharmacists based on the training that they had. So I would encourage you to go to the FIP website and look at the various training programs that are available, and also look at what can be available in your region if you do have the permission and the regulatory authority to administer vaccines. But what I can tell you is that obviously, what is important here is the quality of the education, and we must ensure that community pharmacists do have the proper education, not only on vaccines and administration of vaccines, but also on handling adverse reactions and anaphylactic reactions in particular.
Thank you so much, Emma. And I believe that this really applies to pharmacy professionals all over the world. It's not necessarily just limited to low and middle income countries. I think we now have about 5 minutes, so we can probably have one more questions. And I think this question would be for you, Amy. have you tried asking if the tax for vaccines be removed just to help patients enjoy low price and encourage them to be vaccinated? So it's another way, I guess, of tackling the hesitancy piece.
Yes, thank you. I think there was a question actually about cost, which Matthias also answered in the text. So for most vaccines, that it's funded by the government to try and remove cost as a barrier. So all the immunizations on our national schedule, they have removed cost. So to try and also remove the price for the patients to make it funded by the government. But in terms of purchasing, I don't know if that's the question around tax. Purchasing price for pharmacies, they've often try and negotiate the best price for bulk supply, and our pharmaceutical management agency, which sets the pricing as well, and procurement of vaccines for pharmacies. They often look at like the brands which are most cost effective as well, in order to help it become more affordable for pharmacies. But also, I think with the government subsidies, it really allows patients to access this. And I've also mentioned in the chat, we do have some unfunded vaccines, and there are some patients that still will pay because they require or find it necessary. And then cost is a barrier for some others, in which case they try and defer the vaccine. So there are some options to remove the tax, and there are subsidy programs, which I think have really helped.
Perfect. Thank you for that, Amy. And thank you also for staying with us till the end of the webinar. Appreciate that.
Thank you.
And I see there is another question in the chat box about the pharmacist vaccination project in India. I don't think we can probably address that in just a couple of minutes left. But what I will do, I promise you, in the next community pharmacy section, the newsletter, we will have a full recap of that project and the next steps. So watch out for that, and I promise you we will do that. So we are now at the end of our event, but before we finish up, I just want to give all of you just a final chance if you really want to provide any final quick message, just a few seconds each, if you feel like it. I think we covered everything.
I'm going to reiterate my key message, Sherif. I think because I got a nice message around making every opportunity count. So I think pharmacies, even if you don't have the vaccination, if you're not allowed to vaccinate yet, I think there's still a lot that pharmacists can do in trying to address vaccine hesitancy, to promote education. So even talking about vaccination, normalizing the conversation is making the most of the intervention and every interaction. So it's not only about the actual process of vaccination. And I think someone said to me once, like, vaccination is only the final action, as everything before that is matters most.
Perfect. So very nicely said. Emma, Matthias, any final thoughts? A few seconds.
I would say it's very important to see the healthcare system as a whole system, and we are a part of this system, and therefore is the relationship between the doctors and the nurses. These all are access points to the systems, and all people in the system have the same goal, to bring healthcare to the people. And we are part of this, and in this moment we have to feel us as a part of this system and work as a part of the system. And I think this is very important for our daily work to do this. And at last one, again, the trust of our patients. This is a healthcare currency.
Thank you so much, Matthias. Emma?
Yes, and from me, basically, I want to reflect and share with you how the importance of having the population on your side. So if you have built that relationship with the population, that trust relationship, and you use it in order to make every opportunity count in terms of these, in terms of not only vaccination, but also in terms of other types of public health interventions. If you have the population on your side, it's more likely that governments and healthcare insurers will want to collaborate with you, because that's also their population. So it has been incredibly important in Portugal to measure these indicators and economic benefits, not only from the government perspective and the health system perspective, but also from the people's perspective, and involving them in the processes, and also have them advocate for the involvement of the pharmacists in this process. So I would just like to reiterate that as well.
Thank you so much, Emma. A lot of great insights shared with us today. I don't know about you, but I think for me personally, I'm going to be listening to this webinar again. And if you want to do the same, make sure to go to our YouTube channel or our events.fip.org, and you can listen to the recording of this webinar. And also, while you're there, you can check out our upcoming events and you can register to attend them as well. And a quick reminder about our next FIP Congress in Copenhagen this year. A great opportunity to connect with colleagues from around the world and to learn and share best practices. So please make sure to mark your calendar and to try to join us in person over there. If you'd like to attend, you can take advantage of the early registration fee, which is by June 2nd. So it's coming up fast. And we're a couple of minutes over time here. But with that, I would like to thank you again for making the time to join us today. And thank you so much for our fantastic speakers. Have a great rest of